1. Pneumatic dilation. A procedure where a balloon is inserted into the lower esophageal sphincter, LES, via endoscopy, and then inflated to stretch and weaken the muscle, allowing food to pass more easily into the stomach. Pros: minimally invasive, often effective after 1 or 2 sessions. Cons: there's a small risk of esophageal perforation, and it may need to be repeated over time if symptoms return. Conversation. Doctor, pneumatic dilation is a non-surgical treatment where we use a balloon to stretch the muscle at the bottom of the esophagus. It can be quite effective, though in some cases, it may need to be repeated. Patient: will I be under anesthesia? Doctor: yes. We'll use sedation so you're comfortable, and the recovery is usually quick. 2. Botox, botulinum toxin, injections. Botox is injected into the LES to relax the muscle temporarily, providing relief from symptoms for a few months. Pros: quick, minimally invasive, and often effective in patients who cannot undergo surgery. Cons: temporary relief, typically lasting 3 to 6 months, so injections may need to be repeated. Conversation. Doctor, Botox injections into the esophagus can temporarily relax the muscle, relieving symptoms for a few months. This is ideal if you're looking for a non-surgical option or aren't ready for a more permanent solution. Patient: how often would I need this done? Doctor, the effects last around 3 to 6 months, so you may need follow-up injections. 3. Hilar myotomy, a surgical procedure where the LES muscle is cut to allow food to pass more easily. This can be done as a laparoscopic surgery, minimally invasive, or through a newer endoscopic method called POEM, peroral endoscopic myotomy. Pros: long-lasting relief, often permanent, with low recurrence rates. Cons: invasive, with a risk of complications such as reflux and a longer recovery time compared to other treatments. Conversation. Doctor, hilar myotomy involves cutting the muscle at the bottom of the esophagus to permanently relieve symptoms. It can be done laparoscopic or through endoscopy in a procedure called POEM. Patient: is this a major surgery? Doctor, it is a more involved procedure than other treatments, but it's usually effective long-term, so many patients only need it once. 4. Peroral endoscopic myotomy, POEM, a newer, minimally invasive endoscopic approach to hilar myotomy. The procedure involves passing an endoscope through the mouth and cutting the LES muscle from within. Pros: minimally invasive, effective, and often with a quicker recovery than traditional surgery. Cons: risk of postoperative acid reflux and specialized technique, so it's not available in all locations. Conversation. Doctor, POEM is an endoscopic method where we relax the muscle using a small incision from within the esophagus. It's less invasive than traditional surgery, with similar benefits. Patient: does it have any side effects? Doctor, there can be increased reflux after the procedure, but medications can help manage that if needed. 5. Medications. In some cases, medications such as calcium channel blockers or nitrates may be used to help relax the LES and reduce symptoms. These are typically prescribed to patients who are not candidates for other treatments. Pros: non-invasive and can help manage symptoms in the short term. Cons: less effective than other treatments, with side effects such as headache or low blood pressure, and usually reserved for temporary relief. Conversation. Doctor, if you're not ready for a procedure, we can try medication to relax the esophagus, although it may not be as effective long-term. Patient: are there any side effects? Doctor, potential side effects include headaches or dizziness, but we'll monitor how you respond and adjust as needed. Follow-up and long-term management. Lifestyle adjustments. Patients may be advised to eat smaller, frequent meals, chew food thoroughly, and avoid lying down immediately after eating. Managing reflux. Since many treatments for achalasia can lead to acid reflux, proton pump inhibitors, PPIs, or H2 blockers may be prescribed to reduce stomach acid. Follow-up testing. After treatment, patients might undergo periodic esophageal manometry, or EGD, to monitor for recurrence of symptoms or complications like reflux.